Thank you very much for your interest in these issues. I'm here to talk about them from the standpoint of the evidence base of how and why psychotherapy works, and to share some research findings that are relevant to the Kaiser proposal. I'm a licensed clinical psychologist. I'm in private practice in Chicago. I'm also the chair and co-founder of Psychotherapy Action Network, a nonprofit that advocates for the public's access to care and also for clinicians and the clinical standards needed to provide that care. We conduct a lot of our own research. We've produced a lot of publications, from white papers to articles to a book, Advancing Psychotherapy for the Next Generation. And founded in 2017, we've grown substantially since then. What makes psychotherapy effective? It's the relationship. You've heard a lot about the alliance between the therapist and the patient. This has been studied for decades in many different forms of research, and the same conclusion is reached time and time again. This means the therapist must be able to assess, build, maintain, and adapt that alliance with each individual patient over time. When you mess with the alliance, you mess with what makes therapy work, and you mess with what makes therapy therapy. Effective treatments must also be individualized, not standardized, for each patient, and they must be of sufficient depth and duration to ensure recovery. Each person is unique in terms of many factors: their diagnosis, their complexity, their personality, coexisting issues, trauma history, resources, identities, and more, and the care must be individualized to them. Helping people with issues like trauma, addiction, abuse, relationship stressors, it doesn't work like an antibiotic does, where it's the same treatment for everybody. When it comes to mental health, different people need different approaches and different models of care. Evidence-based standards of care show this as well. We have to treat underlying and chronic conditions. And when we talk about depth, we're talking about getting underneath those superficial symptoms. And when we talk about durations, we're talking about, for many people, 40, 50, or 75 sessions of care. This is the standard of care. So, Kaiser's first proposal is to have sole discretion over the model of care. This directly interferes with what we've just discussed about how and why therapy works. This is messing with the alliance. Mandating a single standardized model of care contradicts the evidence base and the importance of the therapist to assess, treat, and adapt to each patient individually. One size fits all works for no one. With this proposal, I would predict that outcomes will worsen and people will not feel helped or understood, and they will drop out of care. Secondly, Kaiser wants flexibility over substituting the work of licensed clinicians with AI, and a refusal to maintain the language they agreed to in Southern California. This is very serious. This won't bode well for mental health outcomes either. It's really best to think of AI mental health tools as self-help. That's where they are today. They're self-help interactive guides, interactive journals. They are not an equivalent, let alone a replacement for psychotherapy by any means. So using more AI means giving people self-help tools. The safety risks are very high. I'm sure you have all heard in the press tragic cases of people dying by following the instructions of AI chatbots and the biases and stigmatized information that's inherent in the large language models. No long-term studies exist to show whether AI-enabled treatments even work. And several states, including mine, Illinois, have already restricted AI for these reasons to a support role only, which is where I think it needs to be, and these tools also need to be regulated by the government, by the FDA, just like any other medical intervention. I'm not going to go through all of these, but I just want to show this slide, the risks of trying to replace psychotherapy with AI. The list is long, and there's a lot of serious items on this list. As far as outsourcing without restriction, Kaiser wants the flexibility to outsource psychotherapy to outside providers, which is very concerning in terms of that therapeutic alliance, as well as clinician autonomy and job satisfaction. Sending patients to other clinicians directly severs the alliance. This will compromise treatment outcomes, dissatisfy patients, dissatisfy therapists, and increase patient dropout rates. This is messing with the alliance. While this may save Kaiser money in the short term, it's a very costly long-term strategy. When people get effective psychotherapy, they actually have fewer ER crises and ER visits, lower hospitalizations, and actually lower overall medical spending. They take better care of their mental and physical health. The entities that Kaiser wants to outsource to are particularly problematic. There's already research and studies out there showing that these platforms have significant problems in a variety of areas, from treatment efficacy to therapist satisfaction and confidence in the platforms, patient privacy, transparency, and more. Here's a bit more detail on these problems. This is from a research study that we conducted and published last year on these platforms. Privacy problems. These companies don't adequately protect patient information. This is the foundation of care. Their investors are big tech firms, and they outsource to AI companies, and there's a lot of data sharing and AI training going on. Lack of transparency regarding really basic things, such as who owns these companies, who are the major investors, how are therapists even paid? These are questions that therapists who use these platforms currently do not know the answer to. And there are a series of policies that many of these platforms have, which really are adding up to trying to replace actual psychotherapy with mere crisis management. Regarding Kaiser's desire to no longer protect the full meaning of clinical care, clinical time includes not just the face-to-face meeting with the patient. There's a lot of consultation, collaboration, and coordination with other therapists. If you're seeing a couple or a family, you have to interact with the other therapists seeing the other part of the couple, the parents, the kids, psychiatrists. There may be medical doctors involved if there are serious medical issues going on. These tasks are just part of care, and they take time. If new intakes are scheduled into this block of time, this is actually quite bad for those new patients because they're unlikely to be seen again anytime soon, and it's also not good for Kaiser. They will be creating a system that just gives an illusion of access without any real meaningful access to care. For therapists, having basic autonomy over their own schedule is a documented protective factor against burnout. Burnout is a direct precursor of turnover, and turnover, as you know, would be exceedingly expensive for Kaiser. It's also really costly for patients. When their therapist leaves, most of them drop out of treatment altogether. Kaiser's proposals taken together will undermine the very factors that make psychotherapy effective and even possible, and there will be negative results and high costs to clinicians, to patients, and even to Kaiser itself. I strongly urge the board to reject the Kaiser proposals and support clinicians and the Therapeutic Alliance and what we know makes for effective care. If you said we're going to assess and diagnose by a robot and then give the same treatment to everyone, regardless of how they respond to it over time, and mess with the very thing that makes therapy effective, you know this sounds like a terrible idea. So please, I urge you to stand up for the principles of effective evidence-based care and what we know as far as what works for clinicians and patients. Thank you very much.
My next set of questions is for Dr. Michaels. Dr. Michaels, based on the testimony we have heard from NUHW members, it seems like Kaiser is increasingly outsourcing clinical work to practice management companies, which most people call internet therapy platforms. What concerns should we have about how these companies are structured and how they manage the clinicians whom they use as independent contractors?
Mm-hmm. Well, thank you for that important question. These companies, these platforms are backed by three large and powerful groups. First, private equity and venture capital investors. Second, big tech companies, including Google and Amazon. And third, the major traditional insurance companies. Yes, they are directly involved and are major investors in these platforms. So this trio, they share a focus on profits, and they share a focus on pursuing growth and cost cutting. What they also share is that they don't necessarily know all that much about psychology or mental health care. They're very concerned and organized around how they can make money and make money for their investors, and they are not concerned or organized around what makes for quality care or the conditions needed for patients or therapists to provide that. Also, clinicians who are connected to these platforms are 1099 contractors. This is an Uber model. The platforms have a tremendous amount of control over the policies and things actually that rightly should be clinical decisions. So platforms are obtaining clinical data directly from patients without even asking or informing therapists. They're going around the therapist to get this data. They're also pressuring, for example, therapists in different ways to use their AI scribing and documentation tools. And they're collecting a massive amount of data, and this includes recording and retaining entire transcripts of therapy sessions. So yes, they want the data, which is extremely vulnerable and private. So they are on the path to training their own chatbots and also developing capitated payment models that will radically change the viability of mental health practice. So many, many concerns, and we documented a lot of this in our research report on these companies last year.
Thank you, Dr. Michael. And also my next question is, what elements of what Kaiser is proposing are different from what you have seen from other insurers? And what impact do you think they would have on industry-wide practices affecting patients' access to affordable quality care and the ability of clinicians to provide its care ethically and sustainably? Well, insurers are not proposing models of care, for one. They are not messing with the alliance directly, as Kaiser would be in their proposals. Traditional insurers are not mandating usages of AI. They are doing other things with AI. They're trying to create their own AI models and products. Aetna even announced a single-session AI product for 2027, which is extremely problematic. But they are not showing the same kinds of intent to with what Kaiser's wanting to do with substituting or using AI in those ways. But insurers do try to cut costs, similar to, I think, what Kaiser's doing. But they're not really inserting themselves into the definitions of treatment and directly overriding clinician autonomy in the ways that we've talked about and you've heard about today. I think all of these proposals from Kaiser would really add up to a drastically reduced access to care for patients. They're going to get less quality care, and these proposals will drive therapists out of the Kaiser network. So if patients want care within Kaiser, they're going to have to wait for it, and if they can't afford it, they will probably be likely to seek it outside of Kaiser and pay for it themselves. So I think it would be a very bad recipe for clinicians and for the public.
Thank you, Dr. Michaels.